can ask the panel a question.
Don't be shy, kids. That's everything we ever wanted to know or afraid to ask of the Affordable Care Act.
I have a question.
Great.
Good question.
Hello, my name is Thomas Scotland. I'm from Portland, North Dakota. And first of all, just thank you for coming. It's nice to have an opportunity to ask questions because I have lots of questions and concerns concerning the Affordable Care Act. I'll start with a softball. How many people have enrolled in Obamacare so far? This is saying
Dakota or across the country?
country.
I don't know that that's public.
No, those numbers haven't been released yet. I think Secretary Sebelius said they'll be coming out in probably sometime in November.
Okay. Have any of you on the stage enrolled, and how long did it take?
I think we're all lucky enough to have healthcare coverage, which, you know, we're very, very fortunate to have. I know that we've had some reports within our organization of people having getting immediate access, and others that have tried 5, 6, 7, 8 times and not been able to get access. So I think it's extremely variable. It depends on the time that you try to access and you know, if it was early on or later. But I think that others maybe have other experiences they can share.
Is it working? Okay. From what I understand from the people that I work with that have been getting people through here and there, that it depends on the family size, because you do have to put in a lot of information, but about an hour or so. If it's just you're a single person putting in your stuff, you could get through it in about a half hour. And then you're supposed to get real-time enrollment information, like the different plans back right away. I think that's where people are getting stuck. Like they can get through and submit the application, but they're not getting the real-time answers. So it's not a long process once you can get through it.
Okay.
Just to also add, I don't know, this isn't a time element, but the gentleman who runs the Navigator program for North Dakota informed a few of us a week or so ago that the very first person in the United States to go through the marketplace and get enrolled was from North Dakota.
All right. You mentioned being grandfathered in with the healthcare plan. So a big selling point with Obamacare was being able to keep your healthcare if you liked it. Is that something that's still a fact? Can you keep your healthcare plan if you want to keep it?
On the employer group side, it's kind of, like I mentioned, it's kind of predicated on the employer kind of staying the course and not making changes that would bounce them off the grandfather status. And as long as you stay grandfather, you can keep your plan that you're on indefinitely. But it really depends on what kind of changes they might make over the period of years. And then on the individual market, I think the ones that have lost their plan have been plans that weren't up to the government standard of 60% actuarial value. And so then those plans are, in our case of our company, we had one plan that fit that criteria. And so then we map those people over to a plan that meets the requirements. So it's kind of a hodgepodge. Overall in North Dakota, I mean, the vast majority are keeping their plans. And if they're not, then there's unique circumstances what's causing them not to keep it.
Okay. You also talked about navigators, and there's been instances of navigators having a criminal record. So what are the credentials for healthcare navigators, and are you aware of and why they do not require background checks?
That I'm not familiar with at all. I haven't heard anything
no,
about that.
I can answer that because we had to certify, we're not navigators, but because we had to both certify ourselves, we had to agree to protect all private information, and we had to do background checks not only on our employees, which we would have to do as healthcare providers, but also on anyone who volunteered. So I'm not sure that the idea that navigators have records, you know, based on what I've seen, it would be pretty hard for that to happen. That
I have lots of questions, but if anyone else wants to jump in, they can. I don't want to hog the whole.
There's a question in the back I think we need to share. You know, just another comment I want to make. I think some of the things we're going to see is people moving maybe out of some plans that they've had into an opportunity to have better insurance. Neil Sharpie, again, the director of the Navigators in North Dakota, who's also a navigator himself, told us one of the women that he worked with had a health insurance plan where she was paying $300 a month, and she had a $10,000 deductible. So basically that's a catastrophic care plan, because that's a lot of money that would have to come out of her pocket before her insurance would kick in. The new plan that they were able to enroll her in starts out, and just bear with me, she was paying $300. The new plan is $390 a month. So that goes up. She has a much better deductible. But because of her income level, because of the credits that are applied, that $390 goes down to $100 a month. So she went from paying $300 a month with a really high deductible to a health insurance plan that gives her more services and costs her $100 a month. So that's hopefully what we'll see more people being able to move into. There's a question in the back.
I actually have a couple, but my name's Marisa. I live in Hillsborough. I do have a question. I am technically a family of 3 right now, but I am currently pregnant. Would I consider myself a family of 4 when applying for insurance? Would I? Because you technically don't know when your baby's going to come. Like, it could come early, you don't know the exact date.
For Medicaid, is it on? For Medicaid, that unborn baby would be counted as a family member.
And then my next question is, my husband kind of has a temporary job, so at any moment it could end. Would I want to go based on his income or my income? And if I do go based on his income and his income's gone, how is that going to affect my insurance I applied for?
That's really good advice, and that is do a really good job of projecting what your income's going to be for 2014. So if you think he's only going to work for 2 months, then use your income at 2 months of his, and that would be your total. That's what I would do.
The other thing, the advanced premium tax credit that you get for, you know, assistance, it's actually based on each month. So if something changes during the year, then the advanced premium tax credit could change too. So it's not a commitment to 1 year, because people's incomes can change in the middle of the year.
No, they're not dumb answers. And these questions will go on until we feel that we've kind of wrapped up, and then following, if you feel you haven't really gotten your questions answered and want to spend a little more time with an individual, they won't kick us out of here until 10 o'clock, so we have a little bit of time. Do you have any other?
You know, from a formal perspective, as the moderator, I plan on ending on time at 9. So that is my prerogative. But again, we can stay, people can leave, but if people have questions, they can ask the panel informally.
Say, does the subsidy follow to a non-marketplace provider? So if I went outside the marketplace and got a policy, does the subsidy follow to a person then? Or do you have to go through the marketplace to get the subsidy?
In North Dakota, you have to go through the federal marketplace to get the subsidy. If you bought directly from an insurance company, you're not going to be able to get the subsidy.
Okay, so if I got something in the mail that my policy was terminated and they've got an alternative, I wouldn't get it. Wouldn't get a subsidy, right? Is that what you're saying?
I mean, you're going to want to check, you know, based on your income.
Yeah.
You know, if somebody's not capable of getting a subsidy, there's no obligation to go to the marketplace. You know, you could just go direct if you wanted. And actually, the individual rates on exchange or off exchange, these metallic plans are the same. But the real defining factor here is, am I going to be able to get a subsidy? If that's the case, you absolutely got to go to the online marketplace, the exchange.
Okay, thanks.
Any others?
Okay, under this circumstance, you are already on Medicare and you are enrolled in a supplemental plan. Does that affect anything? Does your supplemental plan change? Should you be out on the marketplace looking for something different? And what
Well, I
about,
was pointing to Brad. I guess he's a moderator. We're supposed to answer, but Brad indicated, that market has really remained unchanged in terms of if you've got Medicare with a supplement, it's business as usual for you. What's really changed is the under 65 market for individuals, and also there's a lot of substantial amount of things for businesses.
so a supplemental plan, prescription drug plans, that pretty much that's all remains the same, so you really don't have to do anything.
Correct.
Thank you.
So again, if you're Medicare, you're golden, so to speak. So, other questions? I have one that came in. There's a gentleman down there, if we could go, please.
I have a couple that came in.
Okay, and there's the one that came in over the email too.
Is this tax credit sent to people every month, or how is that paid to people?
That's a good question.
Okay, I'm being kind of a Budinsky here because you guys can answer too, but the advanced premium tax credit, once you go out and, determine the plan that you want to go on and you look at the price, there'll be, based on your income, there'll be a premium tax credit for that. And that'll be calculated, and then what you owe is the difference. So it's really instantaneous. And you'll just, let's say your premium's $1,000, but your tax credit's $500. You'll owe the $500. You don't pay the $1,000 and wait for a credit to come back. Yeah, goes to the company. The main thing as a consumer is you're getting assistance on that immediately. Did I botch that up? Okay, all right.
Brad, if I can throw in one of the email
Okay,
questions.
I've got an email one too.
It says, I have insurance through my employer, but I contribute towards the premium. Could I apply for federal subsidy to assist with my cost of the premium? If I have insurance through my employer, but I contribute towards the premium. Sorry, I repeated that. It's a double liner. They're asking if they are receiving insurance through their employer, but the insurance doesn't pay all the premium, can that employee qualify for subsidy?
As one of my colleagues at Blue Cross would say, it depends. But Gail, I know you've heard him say that. It gets back to, within that workplace, does your employer, or in fact in your case where we're asked a question, the part that you pay for a single plan at that employer, is it exceed 9.5% of your annual income? So it really depends. You've got to take a look at what your annual income is and what they're taking out of your check over a period of a year, and does that amount cumulatively surpass 9.5%? If that's the case, you're working for somebody under the definition of law that does not provide affordable coverage, and you're free to go to the marketplace and try to access a subsidy. But if your employer, my example before was, let's say you're working for somebody and they're paying 90% or 95% of a single, it's highly doubtful that you'll be able to go get a subsidy.
Okay, thank you.
Okay, one of the email questions that we had gotten, and this is interesting because it really shows how individuals are in their own unique situation. This is a husband and wife, and they describe themselves as being pre-Medicare eligible retirees. They've been part of North Dakota Public Employee Retirement System that basically gets run through Blue Cross Blue Shield, and they said NDPERS will no longer administer paying the monthly premium payments to Blue Cross Blue Shield, and also will not pass the healthcare credits on to the exchange plans. So they asked, we cannot find a comparable plan to match what we have now. According to the a.k.a. North Dakota Exchange listings, the best Blue Cross Blue Shield plan being offered for Trail County is Gold Plan Blue Care 90-2000. Will platinum plans be available? They also mentioned that Medica has a plan called Medica Applause Gold Copay, but the only info I can find, he says, on this plan is at the Minnesota Sure website. So that's one question. Does anybody want to try to address that? I have no clue as to how to answer that.
Yeah, I don't know if I can answer all of that. The thing about the plans that are out on the exchange, they're not always going to look like what you had before. I mean, even businesses that are getting moved from their current plan over to metallic plans, they really kind of, I mean, they have similar actuarial value, that goofy term I was talking about, but they don't really look like the old plan. I mean, they might have different deductibles. They might have a higher deductible, but that co-insurance, instead of paying 80%, maybe pays 90%. So there's a lot of different variables. Insurance companies are now mandated to offer products in every one of those metallic series. And so I know for us, we have 13 plans from bronze up through gold. I don't see a platinum plan here. And I don't know about the other carriers, so, but that would be an option that insurance company could have. I'd say whoever asked that question, if they're here, they could just grab me afterwards too. I've actually got a complete price list here. We could take a look at something that's comparable.
The other part of their question, and I think I may be able to answer this, but I'll give it a shot, and when I'm wrong, somebody please feel free to correct me. But they also asked, they have been in Grand Forks, and now they're living more in Trail County, so they have physicians in Grand Forks at Altru. And I think their question is basically is whether or not, by the fact that they might be having a plan that they're getting while they're in Trail County, do they lose their physicians that they're seeing in Grand Forks? And I think the general answer is no, they can still see the physicians that they were seeing regardless of the plan, how the plan may change for them. So am I basically right in that type of answer?
Well, I think you're basically right, Brad, but you have to be careful because there are some plans out there, in particular in Minnesota that I'm familiar with, that have a narrower network. So in other words, the insurance company, in an effort to be as efficient as possible, has kind of limited the number of providers in their network. So you have to really pay attention to who is in the network now, because you can't necessarily always be assured that all your providers are going to be covered on that product. So that's something that people here kind of take for granted, because with Blue Cross in North Dakota, for example, everybody's in. It's you go wherever you want, but now you're gonna find more and more that the network itself is going to be pretty narrowly defined, particularly in some of the bronze plans. Is what I'm seeing. So.
Well, being from UND, being basically right is as good as it gets some days, so I'll settle for that. Did you have another email question there, Gail?
I think all of the others got answered through
Okay.
some of the other questions that were asked.
Okay. I'm going to allow the gentleman in the back. I think we've got time for one more question if you have it.
Just one more?
Huh?
Just one more?
Just one more, and then we got to close it out. You can stay, and I'm sure if the panel can, if they can stay, but I know some of them have to get back on the road, so.
Why should young, healthy individuals sign up for something they don't need and can't afford?
I think, oh, good. I got an answer for that too.
I have a son who's about your age, and for years he was uninsured, and then a really terrible thing happened to him, and he ended up in the hospital for 4 days and had 3 MRIs. That was about $30K. He would have had to pay every dime of that $30,000, and as an uninsured person, he's a generally healthy, 20, 30-something guy, takes good care of himself, doesn't drink too much, doesn't use drugs. This random thing just happened. That's why. Because the uninsured are the only ones who are paying the full price for accessing health care. A lot of people, as I understand it, think that if they go to the ER, that's free because they can't turn you down. But there is about a $500 tab that goes with that, and that's on you as the uninsured person. So I would just say, and that sounds like your mom talking, I'm really sorry.
Wasn't that personal responsibility though? That's his own responsibility?
It is, but how many people have, the current standard of care for appendix that might need to come out as a CT scan, where the cost of that is $1,600. Yes, it's personal responsibility, but I think, as Martha pointed out, most people aren't particularly financially responsible about those kinds of bills. For the 35 years I've been in healthcare, or 40 now, the last bill to be paid is the healthcare bill. People just put those off because who's got $1,600 laying around? $430, you know, it's a lot of money.
I think another way of thinking about it too is on from the other side. From a fairness perspective, why should people who pay premiums every month, or their employers who pay premiums every month, have to subsidize someone who just won't go out and buy insurance? So it's basically a cost shift that way. So that's another way of looking at it.
Yeah, I think the other thing is about, personal responsibility. You can be as responsible as possible about your health. Stay healthy, exercise, and so forth. But, cancer isn't about personal responsibility. I mean, things randomly happen, accidents randomly happen, but incidence of disease is not necessarily correlated to how healthy your lifestyle is. People who are very, very healthy get cancer, and it's really expensive. Really, really, it can devastate you financially. It's all about risk and managing risk. That's what insurance is all about. And for the most part, the risk is just random. You can't predict it.
So when a healthcare provider is forced to pay for an individual's insurance, they don't measure risk because they're forced to pay for it. So that's not really insurance.
We'll let you ask that last part, and then we're going to have to close up.
When an insurance provider is forced by the government to pay for healthcare, they don't measure risk anymore because they're forced to pay for it. So this isn't really insurance. They're not measuring risk, they're really forced to pay for something.
No, it's all about it. I mean, that's what actuarial valuation is all about. It's assessing the risk. I don't know how else to put that.
Well, I think that's as good as the answer's going to get. So I know Gail wants to have some closing remarks, and I certainly, as a moderator, want to say thank you to all of you for spending 2 hours with us tonight. I want to say thank you to the panel members, and thank you sincerely. And Gail,